Moment. Everyone, welcome to Falls. Good morning, everyone. Welcome to Falls Free Friday on this wonderful first week of fall. My name is Elizabeth Head. I am the Deputy Director for Injury Prevention at the Georgia Department of Public Health. I also co-chair the Fall Prevention Task Force, which is out of the Injury Prevention Research Center at Emory. On behalf of DPH and on behalf of our task force, we are so excited to bring you a really exciting and timely presentation today. I would be remiss if I didn't thank some of our partners, certainly our friends at the Injury Prevention Research Center at Emory. They have manned every single one of these Friday events for us. They will also be posting every recording from this month, which I think we're up to 6, maybe 7 recordings. They'll be posting them here in the next 2 weeks. So any session that you've missed prior to today, you can go onto the iPrice website and their YouTube channel and find those recordings. A lot of fantastic demonstrations and topics that are both directly and indirectly related to the prevention of falls and the promotion of independence for folks as they age. I'd also like to make sure we thank some of our other key partners. Shepherd Center has been with us working on fall prevention for more than a decade now. Our friends in the academic community, Mercer University, our friends in the nonprofit communities, Georgia Gerontology Society, so many professionals working to bring Falls Free Friday events to our partners and communities around the state, as well as happening the work that's happening around evidence-based programming to reduce falls as a whole in terms of burden for our population. Today's speakers are Christian Ross from Happy Talks. For over 15 years, Christian has been immersed in connection, helping families with their most personal asset, their home. Advising clients in Atlanta and spanning 15 different countries, the experiences she faced motivated her to develop a solution to the loneliness she witnessed firsthand with clients and family. Happy Talk serves as a life buffer for families. Focused on the power of listening, members enjoy quality conversations with scheduled social chats, and families receive updates through their tech-enabled platform. Christian is involved with the Senior Resource Alliance of North Atlanta, Atlanta Senior Care Network Niche, and on the board of Age Tech Atlanta, which focuses on technology solutions for elder care. When she's not delivering happiness, you can find Christian trying new foods, supporting Atlanta's startup community. She is also the host of Atlanta Startup Village at Atlanta Tech Village. She also loves to enjoy time with her husband. Also joining us today is Amanda Jackson from The Key. Amanda is an certified occupational therapist with more than 8 years of experience. She is a certified aging in place specialist and certified in LSVT, big protocol for Parkinson's disease. She currently serves as a senior home care liaison for The Key, which was formerly Home Care Assistance. This is a longtime national provider of quality in-home care. Her passion is to enable older adults to age in place by providing education and home care assistance through The Key. Her background as an occupational therapist and certified aging in place specialist give her a unique perspective on the needs of older adults to live and to age well. Ladies, I turn it over to you. We're so excited to have you here today.
Thank you for having us. Thank you so much for having us. We're excited, and we want you to know that we want this to be interactive. We want to talk with you. If you have a question, you can put it in the chat. But we're going to talk about today managing fall risk and social isolation for optimal health. Because the reality is that we all just want to be happy and to have optimal health, to enjoy that. So it's presented by us, and thank you so much for sharing our bios, and thank you so much as well for just letting us be here to share. Can everyone see our screen?
Yes, ma'am.
Perfect. Well, let's see if it will. There we go. So, we want to talk about you. If you have questions, put them in the chat. It's interactive. We're going to discuss strategies for reducing fall risk in older adults and the importance of social connectedness, because we know, life it's funny. There's all these different things. There's all these different things coming at us right now between the news and things happening in the community, whether they're good, bad, indifferent, whatever. But there's a lot of things coming at you. And so we just want to make sure that you understand, again, the risk with falls, as well as the importance of being socially connected. Let's see. Is it going? There we go. So I am going to let Amanda take it away as we talk about falls.
Thank you so much, Christian. So these are just a few little tidbits. I'm sure you guys know a lot of this information, but it's very important to realize that this isn't just an opinion, right? So the reason why it should be talked about in even on a bigger scale, and why it should be important to our state, national legislation, and everything is because it's huge. Every second of every day, an older adult, it's the leading cause of injury for this age group. So looking at it that way is statistically very significant. And it being such a public health concern is something that you're not alone in it. So this is not just, oh, well, maybe I've had a fall this year and I feel kind of alone in it and feel isolated, which is something we're also going to talk about with isolation, is how that also makes us feel. And it is something that's so common, but also very preventable. And so again, having all these statistics are important to look at and realize that it's very important. And Christian, you can go to the next slide. Perfect. So and this is why it's truly important for us is personally, right? So we know why it's a national crisis, essentially, but why is it more to us? Because it's our families, it's ourselves, it's our friends. So 1 out of every 5 falls is resulting in a brain injury or a broken bone. So if you're thinking, again, you have osteoporosis and arthritis, that's going to really impact that healing process and really impact, and especially if it's a head injury too. So thinking about all these things that can actually be prevented is wild, because looking at the consequence, if we don't put in intervention, if we're starting to see it trip up or noticing that we are increasing our risk for falls, it is very important to address. And you're looking at hip fractures. 95% of them are usually falling sideways even. So looking at this data is just wild. Think of like 1 out of every 5. 1 out of every 5 falls. So that includes the little trip up that we had. It's not always falling down a flight of stairs. Anything is considered a fall when it's kind of point A, point B to the ground. So really taking that in, thinking about it, even if we say, oh, I didn't fall, I just kind of slid, it's still a fall. And so looking at that and consulting your doctor, all that's very important. So Christian, you can go to the next one. So we're going to discuss, and I'm going to go through some risk factors and what can we do about it? Let's look at that, is really taking that approach of, okay, we see how dangerous they are. We see that we're more prone to them, but what can we do about it? And that's why we want to kind of have this approach. So having your healthcare provider review your medications, this is something that's important for everyone, really. Having a list of your medications in your purse and in your wallet is vital. Even myself, I had kidney stone situation recently, and the hospital had no recall of any medications. And a lot of times in our medical system, there's different portals. Sometimes our primary care and our rheumatologist and our gastroenterologist and all of these different doctors, although they are great, and they don't always have the same updated information. So your rheumatologist could prescribe you something that your primary care doesn't know about. And then that primary care prescribes you something, and then those medications interact, and which could be cause of dizziness, vertigo, increased risk of falls. Something as simple as a medication side effect is something. So it's so important that you keep that list, that your doctors are updated, but also looking at the side effects and talking with the people around you and saying, hey, listen, I'm about to start a new medication and it has this, kind of side effect. If you can keep an eye on me, or whether it's your family or definitely a close friend, say, tell me if you notice anything different. That's again another really important part about our social relationships, is someone to keep us accountable, but also keep an eye out for us. So that's something that's big. Medication is just so huge. So even having that one little tip, guys, having that in your purse, being able to have that out, you have the dosage, everything. It makes doctor's appointments so much easier. I do it myself. So highly advise that. And exercise. We know this. Motion is lotion. If you have any arthritis and things like that, like getting moving is so important. You don't have to do yoga and a downward dog to exercise. You can be able to, even going for walks, or if you are having kind of a harder day mobility wise, even just stretching, kind of really making the body aware of itself and decreasing that tightness is going to help prevent those falls. Because those tight hamstrings, especially, are big contributors to falls as well. Another thing, when's the last time all of us have had our eyes and feet checked? So that's very important, even when considering driving, right? It's not always about just your ability, but looking at all these other people operating cars around you. So that split second that you're squinting, like, what does that sign say? And that reaction time, it could be that simple. And so having that regular checkups, or at least once a year, to check that out is going to be helpful. Or in your feet. So if you have any neuropathy, and just in general, especially if you have neuropathy, always looking at your feet, making sure that, the skin is intact and things like that. Because a lot of times we can be numb to it and get a wound and not even realize it. That can be a thing. And so this is all prevention. This is all, falls are preventable. And so looking at things, look at that. Keeping a list, exercising, doing some stretching, 30 minutes a day. All these things make and prevent most disastrous things that can happen to us over the age of 65. And our last, and one of my favorite things to talk about, is auditing how you live in your home, and really taking a gander and being honest with yourself about it. You can go and go to the next one, Christian. So getting rid of, I know you guys are going to hate me for saying it, those throw rugs, they make me nervous. And, that you can say it's every occupational therapist's worst nightmare. But in case you have an emotional attachment, and you must keep them, go get Gorilla Grip shelf liner from Amazon and cut a piece that's just a little bit smaller. Well, actually, you can do it a good bit smaller, but then the width and the height of it, of your rug, and place that under the rug. Because even non-skid mats become not non-skid mats over time, and through wear or through washing. So putting those under every rug in your house will prevent them from sliding. And it's something I actually put all over my grandma's house. I mean, and it's magic. And they also make great jar openers, that shelf liner does. Not to mention, it's shelf liner. You can use it for anything. So that's a friendly tip from me with that. But keeping those floors clutter-free, I know we're used to our environment, but if you kind of keep those walkways clean, it's super important to do so. Second thing, lighting. Lighting is so, so important. And especially when most of our falls, a good bit of them, are happening So when we're rushing to get or just having to go to the bathroom in general, not having proper lighting can increase your risk for falling instantly. And so having those, you can either have those plugins that are motion sensors. So when you walk by, they turn on and they're lighting up the ground, or they have ones that are automatically on when the lights off. So those things are, you can also buy on Amazon or Home Depot. I even saw some at the dollar store. So they're very easily accessible. You don't have to have anyone come into your home to put those in. And I have them in my home because it's pitch black in the middle of the night and I'll bump around. So this is something that anyone can use in their home. It would be beneficial. Also, another thing you guys aren't going to like, but I don't like those sticky grab bars. I don't like them. They are not great over time and they are not always, and they're not weight bearing. So I would definitely look at installing grab bars in the bathroom, like in and outside the tub, or, even where your towel bar is. Now they make really attractive ones. They really do. Home Depot does. And even, Christian and I have a friend named Jeff Gray who literally does this and will put in these beautiful grab bars in people's homes, and they even are disguised so that they have one as a toilet paper holder that it looks very almost artistic and very simple, that it doesn't even look like a grab bar, but it is. And so you can make your home still very attractive and not feel like it's a hospital. So before you say no to the grab bar, know also that I myself have pulled up on a towel bar and pulled it out of the wall and it ended up on the floor at a friend's house. So I say that because does get a little bit of a giggle, but it's true. Those towel bars, people try to use those as grab bars. They're not. So having professional ones are good to look into.
And Amanda, that's a great point, because a lot of times we have the perspective that things are helpful just because they look like something else. Like a towel stand looks like a grab bar. So we think it may have the same durability and the same thing, and it's not. So thank you so much for sharing that, because I know for myself, I've been in the same thing, just like you said, grabbing the towel bar and you're like, it will not hold my weight.
And it's like, it's an embarrassing story, but it's something that happens, and it's just really important to be aware of. So looking at those kind of things to help with that. There's so many newer things out there too that can make your home look attractive. And even if it's alternating it a little bit, it's just modifying. It's not as institutional looking as it has been. And again, if you have stairs, making sure that, there's handrails on both sides of the stairs. And that's another great place to put those sticky lights that are motion censored. Another great place for that. Always lighting up the floor is very good. Next slide.
And I'm going to be talking about modifications as well. But before I start, I want to be able to see everyone while I'm talking, if you don't mind. So my question is, if I put the gallery to the side, can you see yourselves, or am I good? Like, can you just see the screen? I'm just trying to make sure what everyone sees.
It's an individual adjustment to slide the gallery left and right so that you can see people in presentation. Yes, ma'am.
Perfect. Okay. So I just wanted to make sure I wasn't interrupting anyone's view. Perfect. Well, speaking of your environment, I don't know if you know that how we connect with others truly affects our health, like in such a tremendous way. So I'm going to be asking you a lot of questions, and you don't have to answer them, or you can put them in the chat, you can think about them, you can write them down. But my whole goal is to just think about how all of these things affect our health. And so like the environmental modifications in your home. And now I'm talking about your environment of people and connection. So I want you to think about what you would want to see more of in your environment. I know for myself, I like candles, but of course we need to make sure that we put them out. But in my actual environment with people, I want to make sure that I go to the library more. I really love the environment of quiet space or a bookstore. I like seeing other people read. It's something about it that is really fulfilling to me. So think about those things that really fill you. But how we connect with others truly affects our health, because when we experience social isolation or if we experience loneliness, and a lot of people experience an even heightened level during COVID, when we experience this, it impacts us. And I mean, it impacts our heart, which sounds kind of like woo-woo to say, but it actually affects your physical heart. You can have a higher chance of stroke. You can have a higher chance of heart disease. So when we talk about connecting with others to affect your overall health, you have to think, are you connecting with people daily? Who do you talk to the most? Are they filling you up or are they depleting you? Let's see. And I'm not sure if you saw earlier this year, May, our United States Surgeon General said, America is lonely. And he created a framework to say, let's establish a national strategy to advance social connection based on 6 foundational pillars. I'm not going to talk about all 6. I'm just going to talk about 2. Those are reforming your digital environment, making sure your digital environment is safe, and cultivating connection. How do we make sure these informal practices of everyday life, that's how we engage with one another? That's, if the mailman comes to the door, or if you have your favorite person you check out with at the grocery store, or if you have a neighbor that, I don't know if you guys saw The Golden Bachelor last night, that you like to talk about shows with, what do you want more of? But the reality is that those digital environments and those community environments, they affect our health and they influence the relationships we have in our lives. So if you're like, Christian, I have one person that I like. I really don't care for anyone else. Okay, that's fine. But I want to talk about the benefits of social connectedness, because maybe you could find one more person or 2 more people that you want to connect with based on the fact that you know that it will impact your health. So social connectedness has been shown to have numerous benefits. That includes improved physical and cognitive health. Going back to Amanda, means that you're going to be just a little bit sharper when it comes to being diligent about falls. Increased life satisfaction, reducing the risk of depression and anxiety, as we know continues to heighten. And it can also provide a sense of purpose and meaning, which can improve your overall well-being. And I don't know about you, but I just want peace in my life. So, if someone is, again, subtracting and not adding, then I have to rethink that relationship. So again, think about who you are connecting with. And here's some homework for you. And I'm going to put the slides in there so that you can download, but create a top 5 list of those who you enjoy connecting with. I know for myself, I love connecting with my husband. I love connecting with my best friend who I've had since I was 9 years old. We don't talk often. We probably talk every other month. Sometimes we'll talk a few days in a row, but for the most part, we talk every other month and it's a check-in. So these don't have to be a daily connection, but it's just someone that you know that you can call. And if they don't pick up the phone, they're going to call you back. They're going to text you back, and they care about how you are doing. So create that top list of people, create a list of things that you like to do by yourself or with others. I said, I'm going to try salsa dancing. It's going to open me up to a whole new world of people. I like to dance, even though I'm not good. And it's going to, and I also, like I said, love going to the library, and I love painting, even though I can't paint. So the things that you do with others, you don't have to be good at. It's just the fact that you enjoy them and they bring some type of joy to your life. So merge these 2 lists, your list of people who you enjoy connecting with, the list of things you like to do by yourself or with others, and create your own personal connection schedule. think about one person you could call every week, or one person you could text, or, if there's an online group that you like, make sure to go in and just create that schedule for yourself. Create an alarm or put it on a piece of paper, your list, so that you know to follow it. This is part of your personal care plan that affects your health. So just like Amanda said with your medication, having that on a list, have a list of these things. You can check it off and say, okay, great. I talked to Judy today. I'm glad she's doing good. And it also gives you a chance to see how you may be able to help a friend. But in this wildly digital world, I want you to also be proactive against scammers. One suggestion I have is to create a safe word for your family. So you've probably heard all around AI, which stands for artificial intelligence. These literal machines, it's like we're living in a sci-fi movie. Our computers are making things happen faster. They're creating manuscripts for writers. They're helping people get deliveries faster. They're helping people in the workforce create their resume faster. So all these things are really, really good. However, you always have the fraudsters out there. And to be proactive against scammers and thinking of AI, create a safe word for your family. And when I say a safe word, I mean right now with artificial intelligence, people may find a video of your daughter, son, your cousin, your neighbor online. They only need 3 seconds of that video to take their voice and make it sound just like them. So when they call you, they sound just like your neighbor. They sound just like your granddaughter. So if you get a call and it's your friend and she says, oh my gosh, I'm stuck out here. I need you to buy me a gift card. I need you to help, send money to my granddaughter in Mexico. She's stuck, can't go in on a plane. You can say, what's our word, or what's our safe word? And maybe your safe word is pineapple. That person says dog. You instantly hang up, because that is not who you were intending to talk to. They are not a part of your connection circle. And you instantly just say goodbye. So I definitely want us to recap. And Amanda, if we could start with you talking about what to remember.
Yes, well, I wanted to also say that is so interesting. I had no idea about that. I knew that scammers can kind of alter your voice and things, but as far as coming up with kind of a safe word or a quick memory cue of saying, oh, like quizzing that and really saying, but make it so simple as what's the safe word? Pineapple, or like it makes it easy to remember to say, okay, when in doubt, pineapple. That's so brilliant. So yes, remember, preventing falls it's a continuous effort. So being diligent though about keeping up with your medications, keeping up with your doctor's appointments, having, those friends, and that's another really, really good thing is you have a couple of those friends or family members that will tell you the truth and that do know you so well, more than, what can always be observed in the 15-30 minutes that you're in the doctor's office. So just because the doctor might not see it within that time frame does not mean that it's not existing. And so, really looping in those people to say, hey, I'm starting new medication, or I've been feeling off balance lately. Have you seen that? Have you observed that? All of these things are preventable. So again, talking to the doctor. I always say like head, shoulders, knees, and toes. So looking at all of that, but also looking at our mental health. If we're experiencing depression, that's pretty significant. And that's something that is still feels taboo to talk about, but it's very common, and that can affect the medications from it, but also not having those medications to help with that can really affect. And also sleep. If you're not getting enough sleep, we've all noticed, like when we're stumbling around, if we are fatigued, we're more apt to fall. Then like our shoulders, knees, and toes almost, the osteoarthritis, looking into that adaptive equipment, right? I just like the kitschy saying, looking into that adaptive equipment, looking into, some of those home modifications that you could add this whole block that's underneath the toilet to raise it up, where you might not have to have the riser with the handrails, and using those attractive grab bars, and know too that we're one phone call, text, carrier pigeon away, whichever is your method of communication, email, whatever it is, reach out to us. We'd love to do that. But looking at our feet and proper footwear, you could have great tennis shoes, but look at the bottom of those tennis shoes. And if you see it's smooth, it's probably time to get a new pair of tennis shoes because the traction is gone from it. So you want to make sure that you're having proper fitting shoes, but also that traction is good. And wearing, if you're in the house with socks on, don't wear the socks unless they have the non-skid. And they don't always have to be the hospital socks, although I do love those, but making sure that you're just doing all these little tips and tricks that are, when you think about it, so easy to implement to prevent disastrous results. So it's so positive to think that we can prevent these things. And having our friends kind of what Christian is saying too, that social aspect, it's not just, oh, fun, it's nice to catch up. It's a huge component of health. And it's so, so important. So thank you guys so much for that.
And for me, just a reminder, connection is key. And also I want one more reminder with this is now that we've all heard the word pineapple, let's not use that as our safe word because this presentation is going on the what? Internet. So use a different word. I just want to throw that out there. But to reiterate, connection is so key. It's the glue. And not sure if you heard of the social determinants of health. There are all these things, and you can look, it's the Centers of Disease Control talks about it. We have a takeaway for you so that we have some actual fall prevention, links for you to look at, some things about making sure about connection. So you'll be sure to get that with your registration, but make sure that you find ways to connect with others. We are not joking when we say it's a part of your health. And I'll give you a great example. My husband worked from home for 5 years. We had a beautiful money tree. The money tree was sitting right on the side over there, blooming. It's out. It's looking wonderful. He went back to the office a few months ago. I looked at the tree the other day and it's withering. We water it, but the same energy isn't around that plant. It doesn't hear him turn on the TV. It doesn't hear his calls. He's not sitting here pruning it during the day and talking to it. He doesn't think I know. I know he talks to it. But he's not doing that anymore because he's in the office. So now it went from this probably 4 days a week, 3 days a week to really becoming an afterthought. And we are seeing the effects of it in the leaves. We are in nature, and it's a perfect example of why we need that. And I also want you to remember, if you are experiencing loneliness, there is nothing to be ashamed of. Life changes around us. And whether you are an older adult on this call or you are a family member supporting an older adult, remember, it is nothing to be ashamed of. Make sure you are asking your family, how are you doing? How are you feeling? Who are you connecting with? Who did you connect with this week? Who did you connect with this month? Make sure you check in like that. And as we know, fostering connections is important to your health. I have to drum it home because I need you to remember that they're important. But we have to make sure that we find these groups to interact in person or online. They need to be safe. They need to be respectful, and they should be fun. If you're a history buff, like I love watching on, I think it's Nat Geo, they have how they built this. So I love talking about these companies and how they were built, like Kool-Aid and Barbie. And I love these groups that I'm in that we talk about these shows that are focused on historical events, and they're safe, respectful, and fun environments. They're pouring into me. I learned something. It's wonderful. But also too, with connection, remember, it's an opportunity for you to share your gift with the world. volunteer. Maybe you want to help children and help them read. Maybe you want to teach something. You have a skill. You worked 40 years as an executive assistant, or 40 years as a truck driver, 40 years as an executive. You have something to share, and people would love to hear it. And also, too, maybe you want to get back to work. Maybe you want to be customer service support and see what people are complaining about and find ways to help. Maybe you want to work at a local store. Whatever it is, connection is also an opportunity for you to share your gifts with the world. And I definitely encourage that. Again, my name's Christian Ross. I'm the Chief Happiness Officer at Happy Talks, and my partner here, Amanda Jackson. She is a senior.
So much for your time and for your attention. And no, we love talking about this. We love being able to provide good resources. So know that one call, that's all. Just give us a call, text. And we all know we feel better too once we have a good conversation with a family member. We're like, oh, we haven't caught up in so long. We have to do this more often. And we realize how good that is, not only for our mental health, but our physical health. It really is good. So we tie in so well together, and just love to be able to be a resource for you guys. And we're always here.
And please, if you have any questions, we are opening the floor. Just let us know.
I have a great comment from one of our participants about using Tai Chi, particularly Dr. Lamb's Tai Chi for arthritis. Besides being an evidence-based program and being phenomenal for fall prevention, there's also a social aspect of that class, which I think really speaks to your point about the value of that interaction with others. Thank you for that comment, sir.
Yes,
other questions? So yeah, absolutely. Other questions from our audience?
Well, you guys are an easy crowd, huh? All right.
Well, and Christian and I, believe it or not, Christian and I are doing a water aerobics class together.
Yeah, at the YMCA.
Yeah, we're going to the Y. And, even if it's not running a marathon or anything, water is really therapeutic. So if you have any joint difficulties or back pain, really getting in the water and just moving, just walking around in the water can alleviate some of that. And really, it's more fun with a friend too. So again, fall prevention and all the social aspects is great.
Thank you guys so much. We appreciate your time. And share our information. Share information with a friend.
Please do. Everyone have a wonderful afternoon. Thank you so much for joining us on this installment of Falls Free Friday. This does conclude our 2023 offerings, but we're so excited to have ended this session with Christian and Amanda. Have a wonderful